The story of Ugandans fundraising to afford medical bills is not new.
We here to raise some funds for Mimi. Mimi requires about 60,000 US dollars to undergo her second surgery in India.
I get money to cover the hospital bills, especially when it comes to Mulago. Mulago is expensive when it comes to buying drugs. So we manage that way, going to the streets, going to churches, individuals, Rotary clubs, and other organizations.
There are so many children who are still sick and need our support. Please, if you see us here, don't get tired of us. We have nowhere else to go.
Almost every month, a fundraiser is developed to access Uganda's medical facilities to treat ailments. But now, for a third time, government is promising to get a national health insurance scheme.
Uganda will soon follow suit, albeit being the last East African country to introduce the national health insurance scheme.
Players in the insurance industry are optimistic about the scheme. The regulator says that the introduction of a national health scheme will create competition in the sector.
It will create competition actually to everybody who is doing business, who is providing medical services, to do it to the best. Because if you do not give me good service, I can move on to someone else. And it is no longer free service as people claim now. It will be a paid service.
The National Health Insurance Scheme, should it take off, will require employed Ugandans to pay 4% of their income to a kitty to which the employer will contribute another 4%. Ugandans in the informal sector will sign up to community insurance schemes and government will offset costs on their behalf. Raymond Mujuni, NTV.